Yeah, so I'm presenting phase 2 clinical trial data from the STARS protocol. This is the first industry-sponsored protocol in Angelman syndrome, where we're using a compound called Gaboxadol to see if we can demonstrate efficacy and feasibility and safety, but really safety and tolerability are the kind of main outcomes for the phase 2. First and foremost, right, we just have to demonstrate that this is a safe and well-tolerated drug. That was the most important thing. I mean, these patients really didn't have difficulties at all. In fact, the prevalence or the rates of side effects between the different groups, there was 3 different groups: placebo, twice-a-day dosing, and once-a-day dosing at night. The difference was really not significant across the group, so that was really important for us to find out. And then we had a bunch of exploratory measures to try to see what was moving in terms of clinical outcomes. And we used a bunch of different things, but for us, the thing that kind of got elevated to the most important outcome was a global measure called the CGI, or the Clinical Global Impression Scale. And on that measure, we actually did see significant differences between the placebo group and the once-a-day dosing group. So what that did was, well, A, provide us with some real kind of hope and optimism about the path forward into the phase 3. It also gave us some really important information about the differences in the dosing, because what we saw was the difference between the once-a-day dose and the placebo group, but not between the twice-a-day dose and the placebo group. So that gives you some clear, sort of dosing information for the next trial, essentially. This study wasn't powered to really look at efficacy, so I wouldn't say it was surprising, but it was really exciting to see some global change. The other thing we dug a little bit deeper into was what was sort of informing that global change, because Angelman's complicated, right? It's a very heterogeneous condition. These kids are affected by a lot of different issues. They've got seizures, they've got intellectual disability, they've got anxiety, they have lots of sort of motor problems. And so when we saw changes globally, we weren't exactly sure what was driving that change. So digging deeper into some of the kind of exploratory measures and some of the post-hoc analyses, we did see that motor changes, sleep changes, and some of the behavior changes we felt were really driving that improvement. We're moving into a phase 3. We're using these phase 2 data to really inform that design. Because of the findings around the CGI, we're certainly bringing that as kind of the primary outcome to the FDA. One of the things that we're doing that I think is innovative and promising is trying to anchor that CGI specifically to Angelman syndrome. So we've kind of created an adaptation of the tool to specifically target symptoms that we think are going to be improving based on the phase 2 data. I think taking a step back, right, this syndrome was discovered 50 years ago. This is the first industry-sponsored trial in the syndrome. So, in kind of academic medicine, the idea that industry is getting interested and involved for us is really important. I mean, I think it's providing the families with a lot of hope. I think anecdotally, we're hearing lots of stories of real promise with the medicines. That's really, really exciting. It's also exciting to be taking a very targeted approach. Often in neurodevelopmental disorders, we take more of a kind of a top-down approach, just looking at just general symptoms, anxiety, irritability, those kinds of things. But here, because the mechanism is so worked out in Angelman syndrome, this is actually a compound that's specifically targeting what we think are the kind of biological deficits, with the hope of really restoring function.